I remember back in grad school doing my first practicum, and practicum is where trainee therapists start actually seeing clients. Well, the site I was at didn't have one specific modality. You could come from whatever background you wanted. So a lot of the other trainees in my cohort, they came from like CBT, DBT, IFS, attachment theory, all different backgrounds. And I was one of the only psychodynamic people in the building. I wasn't the only one, but I was one of the, there weren't many of us. And I kind of became known as like the psychodynamic guy because I was really into it. Obviously, I still am. But I noticed something kept happening fairly frequently. Like a lot of the other trainees in my cohort would come up to me and they would ask some variation of the same question, like, how did you learn psychodynamic? Or that they've always been interested in it, but they couldn't figure out where to start learning about it. And honestly, like, I get it, especially if you come from one of those more manualized orientations that come with like actual manuals full of worksheets and skills that basically tell you what to do. Like a client comes in like this, and the therapist does this. A client comes in like that, and the therapist does that. And then you could send them home. And then like next week when they come back in, you gave them some homework and they come back and you pick it up and you go from there. And I'm not knocking that. That's actually really useful. And I use some of that stuff myself sometimes. But I can also see why, if you come from one of those backgrounds and you want to start getting into psychoanalysis or psychodynamic, how you're going to feel really overwhelmed because there's nothing like that. There's no manual that says, do this, then this. Another factor is that like with some of those other modalities like CBT, DBT, ACT, there's an enormous marketing ecosystem behind them that almost makes you feel like you have to learn them. And psychoanalysis has none of that. That is to say, the psychoanalytic community has done a really poor job of building an on-ramp for new therapists to its own detriment, really. Because like no one really hands you a way in, not even graduate school programs. Most grad programs like don't even barely talk about psychoanalysis. So when people ask me how to get started, I have to explain that I kind of had to create my own way in at first by reading about it to see if I even wanted to continue enrolling at a local psychoanalytic institute, which that's really where you learn this stuff. But to their specific question, how do you get started? The short answer was, well, I had to start reading books on my own outside of graduate school. And I didn't read them in the order I'm about to give you today, but this is the order that I wished I had read them in. And I want to be clear, this is not some BuzzFeed style best to worst top 4 books of psychoanalysis. That's not what this is, okay? These are 4 books that'll get you up and running on the basics, presented in the order that I wished I had read them in. And then from here, you could see if they resonate with you. And if you want to learn more about it, you could, find local institutes near you, or you could find more advanced books. Okay, but anyway, now with all of that out of the way, let's start with the book that I wished I had started with when I was first learning about all this. And that book is New Introductory Lectures on Psychoanalysis by Sigmund Freud. And that is a very oddly titled book, and I get that. And I want to be clear about that because the title can be confusing. I'm specifically talking about the new introductory lectures, not the original introductory lectures on psychoanalysis, which Freud had written much earlier in his life. This one, the new introductory lectures, Freud wrote this version near the end of his life. And by that point, he finally started to finalize all the ideas he had been building and revising across all his earlier work. And here's the best part. Not only does he have his ideas finalized here, he's actually readable here. He's clear, he's confident, he's concise. He's genuinely an excellent writer. And think about this. Freud never won an award for psychology or psychoanalysis. If I'm correct, the only award he ever won was for writing, for literature. So this is not the long-winded, repetitive Freud from the interpretation of dreams, like the guy who explains everything 100 times, and then he tells you again why he needs to explain it to you another 500 times. This is not that Freud. This is confident old man Freud, just clearly laying out what he thinks is going on with the unconscious mind. And that's why we start here, because this is the version of Freud that all the most later psychoanalytic thinkers have built their theories on. And by now, Freud's worked out the structural model. He's got the id, the ego, the superego. He's got the topographical model, which is the conscious, the preconscious, and the unconscious, and how all of that interacts with our early childhood experiences to shape our personality later on in life. And even just even just me explaining that right now, you could kind of already see the seeds of what later becomes object relations and even its influence on John Bowlby and attachment theory. When Freud describes how our early experiences shape the superego and how that shapes the way we relate to people for the rest of our lives. So that's why we're starting with this one. It gives you the foundational language and the foundational ideas that most everything else in psychoanalysis, in one way or another, got built on top of. And frankly, not even just psychoanalysis, right? I mean, psychotherapy in general. A lot of these other modalities like schema therapy and stuff, they don't like to credit Freud, but they really started here too. This is where, and we're still building on these ideas to this day. And here's the nice thing. Once you read this, you can go back and read all of Freud's other major works and watch how he arrived and developed these ideas over the years. And maybe even catch a few ideas that he moved away from that maybe he shouldn't have. Later thinkers like Lacan and Klein and Winnicott, they brought some of this stuff back that he left behind. But anyway, to get the foundational thinking the way Freud understood in its final, clearest form, this is the book you want first. I didn't start with this one, but I really wished I did because it would have cleared up a lot of the confusion I ran into when I was reading some of these other books later on. But here's the thing. Even though Freud wrote this at the end of his life, once he finally crystallized all his ideas, that was still 100 years ago, right? It's 2026. Psychoanalysis and psychodynamic therapy have come a long way since then. So you're really going to want to know how all of this actually works in the world today. And that's exactly why I have this book as the second book to read. And this is by Bateman, Brown, and Pedder, and it's called Introduction to Psychotherapy. Think of this as like a survey book of how Freud's thinking actually evolved and how it grew into the psychodynamic therapy we practice in the clinical room today. And there are two things in particular that it does really well. First one it does is it explains defense mechanisms. Freud never actually really laid out like how all defense mechanisms work in one piece, even in that final book we just talked about. It was actually his daughter, Anna Freud, later on, who picked up where he left off and systematized his ideas of defense mechanisms. But Bateman and his co-authors on this book break them down here in a way that's thorough and genuinely easy to follow. And the second thing it does really well is it breaks down transference and countertransference in a way that's really digestible. And you're going to see these concepts in the other books later on, but the clear foundational way they're explained in this book is really going to pay off nicely once you get into those other books later on. On top of that, it takes these foundational Freudian ideas and walks you through a lot of the major thinking that came through later. Like it talks about object relations, attachment theory. They talk about mentalization-based treatment a little bit, and even some non-psychodynamic stuff like CBT and CAT, and how you can like integrate some of that thinking in with psychoanalysis and vice versa. So that's what makes it so good. It drops you right into the modern era. And the best part about this book is how easy to read it is. Like you could probably read this book in like a day or two. I wish this had been a textbook in my grad program. Like it's that type of book. So it's building on Freud, still at a pretty foundational level, but it's the kind of foundation you really want in place before you move on to the next book. And that's Nancy McWilliams' book, Psychoanalytic Diagnosis. Okay, and funny enough, this is actually the first of the four on this list that I read. So why am I putting it third? Well, because I think it works even better once you've already got a good idea of Freud's basic language and his foundational ideas, not the crappy grad school version you were probably taught. But either way, read this book. If there's one book on this list that you have to read, this is the one. And one of the reasons it's so good is because she writes beautifully. It's genuinely a pleasure to read. I mean, I wish I wrote half as well as Nancy McWilliams. She just has great prose. But more than that, it teaches you to think past the DSM. It's not like, okay, this person has this disorder, so check that box. It teaches you how a person's personality is organized and structured, what their character is actually like. Personality structure, defenses, how they handle affect, shame, dependency, aggression, where they're rigid, where they're fragile. While reading this book, you're going to start seeing your clients differently. Like you're going to recognize people you know. You're going to be like, oh, I know this client. Or, oh my God, this is exactly like that client. And you're probably going to start seeing yourself differently too. Like you're going to recognize yourself in this book. I know I did. And just the way it brings the whole thing home, your understanding of people, of how somebody's inner world actually gets shaped. It's just great at all of that. That said, there's one thing missing from this book, and that's that McWilliams isn't always totally clear on what to actually do once you recognize who you're in the room with. And like, I ran right into this. I remember reading her section on narcissistic personality organization because I was genuinely trying to figure out how to approach some of my more complicated clients. And she does a fantastic job teaching you how to recognize them and how their defense mechanisms and their structure. But then she basically says, if you want more information on how to treat them, go read Kernberg or Kohut's book. And I was like, okay, thanks, lady. But what the hell am I supposed to do now? But she's right for two reasons. One, you genuinely can't fit all of that into a single book. It'd be like 24 volumes. It'd be like the size of the entire Freud Standard Edition. And two, yeah, all of us probably should read Kernberg and Kohut's books eventually at some point, but they're not on this list because of how complicated and how difficult they are to read. So they'll come later on. So McWilliams really drives home how to see a patient differently, but that's still a little bit different from knowing what to do when it's all unfolding right there in the room. And before you even jump into like Kernberg or Kohut, who are really advanced, there's another book, one that builds right on top of McWilliams and the two that I've already talked about before, and that's Psychodynamic Techniques by Karen Maroda. And here's the thing about this one. If you started here, like if this Maroda book was the first one you picked up, you probably wouldn't even recognize these techniques as techniques or interventions. And that's why, like, I think it's a good idea to read these other books on this list first, because a lot of psychodynamic interventions aren't easily recognizable from the outside when you're not totally in on the language they're using. And like I've said a bunch of times now, there's no checklist, there's no worksheet. What you're actually doing is listening. You're really listening to what the client says. And more importantly, you're really listening to what they don't say. And you're learning to make connections and asking things in a reflective way that gets the patient to explore their own inner world. And Maroda's specific focus is the two-person emotional side of that, your own reactions in the room, the countertransference enactments, and what's actually happening live between you and the client. Because, I mean, that kind of work is genuinely hard to put into words on a page. And Maroda does about the best job I've seen so far. There might be other books out there that are as good, and I haven't read them yet. But out of the ones that I've read, this is the best one. And so it's like one of those books you have to read more than once, because a lot of the interventions are hard to even pin down the first time through, and again, that's why it's number 4, because you're building off the knowledge in those other 3 books. You're building off of those, and then you're coming to this one. And that difficulty grasping such abstract work, that's like part of psychodynamic work that probably scares people off, because you have to be able to sit with a patient in their own worst moments and not come running in to save them. You can't, okay, do this, take this worksheet, do this. You have to be okay with ambiguity. You have to be okay with containment. And most importantly, you cannot flinch. Like, a lot of people have never once in their lives had a safe place to fully break down and put all their baggage on the table for someone else to see and process with them. And when that finally happens in the room, it could be really overwhelming for the therapist too. And you can't flinch. You can't break the frame. And that is really difficult to teach in a book. But again, Maroda does a really good job of explaining countertransference and enactment and how that happens between you and the client. Like I said, there might be other books out there that are good too, but this is, out of the ones I've read, this is the best one. Now, all that said, is this book perfect? No, not really. Around the halfway point, she starts talking about working with patients with borderline personality disorder. And I'll be honest, she lost me a little bit there. She gets a little Dr. Phil tough love type of therapy. And that just doesn't really work for me. I'm just not like that. Look, we're never going to agree with everyone 100%, right? And maybe that section of the book might resonate with you more than it did with me. But either way, all that aside, it's a fantastic foundational book, and I genuinely recommend it as the final stop on this quick start to get started 4-book series. And that's the last thing I want to cover, because the whole point of this isn't to say these 4 books are going to teach you everything you need to know. They're not. It's not like read these 4 books and you're done. It's read these 4 books and now you're ready to get started on a much longer journey you have ahead of you. Because like I said, there's no weekend seminar that you could take. When you do this, you're signing up for, you're basically going to become a lifelong learner. It's never really done. You're always going to be reading. You're always going to be learning. You're going to be taking courses at local training institutes. You'll get your own therapy and your own analysis. You'll join consulting groups with other clinicians. It basically becomes a lifelong practice in trying to understand the human mind. And look, I know some people are probably saying, yeah, but you could do that with other theoretical orientations and modalities too, right? Yeah, you can. But here's the thing with psychodynamic or psychoanalysis, it's not a choice. You have to do it. Like, you're going to become a lifelong learner. It's not optional. And I think some of that is because what we're trying to understand, right, is the human mind, the unconscious mind, which is just so abstract. It's immeasurable, right? Things like the consciousness, unconsciousness, personality organization. These are things that we've been grappling with since the times of like ancient philosophers. And I think that's one of the strengths of psychoanalytic theory, right? It constantly pushes you to learn more and improve. And that's actually why I don't even consider it a modality or a theoretical orientation. In my view, I think of it as an epistemology, a way of understanding people in the world, how you know the things you know. And through this epistemological lens of psychoanalysis, you can then incorporate other modalities and orientations and apply them in your work and in your practice. So anyway, this was my very long-winded way of saying I think these 4 books are a great way to get started in figuring out if you want to become a psychodynamic therapist, if you want to learn more about psychoanalysis. So check these books out. It might resonate with you. If they do, I would love to hear from you. If you read these books or you think I'm completely full of it, just tell me to piss off in the comments. That's all good too. Or if there's any other intro, or if you guys know any books that I missed, and like I said, I don't have time to read all the books in the world. I wish I did, but maybe you guys have read some other great introductory books too. If you have, please leave them in the comments. I'll probably read them myself when I have the time. Anyway, I hope you enjoyed this video, and I will see you in the next one.